I was mentored into it by Douglas Oosterhout. He had gone to Paris very early in the 1970s and was among the first a couple of Americans who had gone over to learn this new field of craniofacial surgery. And in the 1980s, he was asked to do a forehead remodeling on a patient who was transgender. And essentially, there was no literature on the issue. He had to make up the operation as he went along. Without getting into the nuances of how all this came to be, fast forward about 25 years after that, I had moved to San Francisco and had been trained in craniofacial and maxillofacial surgery after my plastic surgery training. And I was approached by a former mentor of mine that Doug was looking to slow down his practice and wanted somebody who might take it over. And so Doug and I had a number of talks about that, and he was explaining to me that a significant, if not overwhelming, portion of his practice was craniofacial surgery on transgender people. And I thought that was very interesting, but it's not something, even having been a fully trained craniofacial surgeon, that you would just assume to know. It's not something that's taught in craniofacial training programs. You need the skill set to be able to do it, but it takes knowing what the result should look like, what the parameters and features need to look like, and the nuances of all that to be able to sort of effectively deliver a result. And so my comments to Doug when we were discussing the possibility of essentially merging our offices and me continuing his practice was that he would need to stick around for a number of years and essentially, at least with regards to transgender surgery, show me what he knows. And that's how I came to know this population. It's how I came to do the surgery, and it's how I came to really love doing the surgery.